inguinal region, right, is the groin. It's called the inguinal region groin. It's an important area surgically because it is the site of inguinal hernias. These hernias occur in both sexes, but are more common in males. The inguinal region is an area of weakness in the inferior part of the anterolateral abdominal wall, especially in males because of the passage of the spermatic cord through the inguinal canal. Let us talk about the inguinal canal. The inguinal canal in adults is an oblique, intermediately directed passage, approximately 4 centimeters long, through the inferior part of the anterolateral abdominal wall. Lies parallel and just superior, about 2 to 4 centimeters, to the medial half of the inguinal ligament. The main occupant of the inguinal canal is the spermatic cord in males and the round ligament of the uterus in females. These are functionally and developmentally distinct structures that happen to occur in the same location. The inguinal canal also contains blood and lymphatic vessels and the ilioinguinal nerve in both sexes, right? The deep internal inguinal ring, which is the entrance to the inguinal canal, in the side of and out bulging of the transversalis fascia, approximately 1.25 centimeters superior to the middle of the inguinal ligament, and lateral to the inferior epigastric artery. The deep inguinal ring is the beginning of an evagination in the transversal fascia, forming an opening like the entrance to a cave, through which the ductus deferens, vas deferens, or round ligament of the uterus in the female and gonadal vessels pass to enter the inguinal canal. The transversalis fascia continues into the canal, forming the innermost covering, which is the internal fascia, of the structures traversing the canal. The superficial or external inguinal ring exists from the inguinal canal. Is a slit-like opening between the diagonal fibers of the aponeuroses of the external lip, superolateral to the pubic tubercle, through which the spermatic cord or round ligament in the female emerge from the inguinal canal. The lateral and medial margins of the superficial ring formed by the split in the aponeuroses are called crura. The lateral curve attaches to the pubic tubercle, right? We are talking about the lateral cross, which is attached to the pubic tubercle, and the medial cross to the pubic crest. Fibers arising from the inguinal ligament, lateral to the superficial ring, arch superficially to the superficial ring. These intercrural fibers help to prevent the crura from spreading apart The inguinal canal has two walls, the anterior and posterior, a roof and a floor. The anterior wall formed mainly by the aponeurosis of the external oblique, with the lateral part of the wall being reinforced by fibers of the internal oblique. Posterior wall formed mainly by transversalis fascia, with the medial part of the wall being reinforced by formations of the conjoint tendon, inguinal palms. The mergings of the pubic attacks of the internal oblique and transverse abdominal aponeurosis into a common tendon. The roof is formed by the arching fibers of the internal oblique and transverse abdominal muscles. The floor formed by the superior surface of the curving inguinal lemma, which forms a shallow right. It is reinforced in its most medial part by the lacunar ligament, a reflected part of extension from the deep aspects of the inguinal ligament to the pectineal line of the pecten pubis, right? From the deep aspect of the inguinal ligament to the pectineal line of the pecten pubis, the iliopubic tract deep curve arc is the thick inferior margin of the transversalis fascia that appears as a fibrous bond running parallel and posterior deep to the inguinal ligament. The iliopubic tract, seen only when the inguinal region is viewed from its internal aspect, contributes to the superior wall of the inguinal canal as it reaches the external iliofemoral vessel from the iliopectineal arc to the superior pubic ramus. The iliopubic tract demarcates the inferior edge of the deep inguinal ring and the supermedial margin of the femoral canal, which is known contains the femoral vessel. Right. Development of the inguinal canal. The testes develop in the extraperitoneal connective tissue in the superior lumbar region of the posterior abdominal wall. The gubernaculum is a fibrous cord connecting the primordial testes to the anterolateral abdominal wall. At this side of the future deep ring of the inguinal canal. The peritoneal diverticulum, the processus vaginalis transverse the developing inguinal canal, carrying muscular and fascial layers of the anterolateral abdominal wall before it enters the primordial scrotum. And this is better seen in the embryology, right? Where we can see whatever is happening at the 12-week of development, where the testis has migrated to the pelvis, and by the 20 weeks, 7th month, lies close to the developing deep inguinal ring, right? And so all these parts and all the stuff that it has to be reviewed, right? You can see, go and take a look into your embryology, right? To see all these muscles from where they're coming from and stuff. Still take a look and see your atlas, right? it mentions something that is very interesting, right? It says, as the testes, its the ductus deferens, and its vessels and nerves descend, they are sheathed by musculofascial extensions of the anterolateral abdominal wall, which accounts for the presence of the derivatives in the scrotum, the internal and external spermatic fascia, and cremaster muscle. Stalk of the processus vaginalis normally degenerates, however, its distal circular part forms the tunica vaginalis testis, the serous sheath of the testes and epididymis. The gubernaculum is represented postnatally by the scrotal ligament, which extends from the testis to the skin of the scrotum. It's going to mention the ovaries because it wants to explain how these things are coming from and how they are attached, starting from the abdomen, right, which are sheets of tendons coming from there. And explains over here the ovaries also develop in the superior lumbar region of the posterior abdominal wall and migrates to the